Before going on holiday, it's a good idea to prepare your skin by moisturising it and exfoliating. So although dermatologists don't ever recommend getting a suntan, if you do get a light tan, these simple measures help it last a little bit longer. Another tip I sometimes suggest is to have a subtle fake tan, because that takes away some of the temptation to get a tan the minute you arrive on holiday, because you look good in your summer clothes the minute you arrive. I recommend people with fair and medium skin tones to wear a broad spectrum sun protection factor sunscreen of 50. More olive tones may be fine with SPF 30 sunscreens. The reason, however, that one should go as high as you can is that there is evidence that nobody puts their sunscreen on thickly enough to achieve the SPF that's advertised on the bottle. And in fact, the amount of sunscreen that people put on is between 1/4 and 1/2 the amount they should. Therefore, the higher you start off with, the better it is. If you're fair-skinned, you should stay out of the sun between the hours of 11 and 3, because these are the hours of the highest sun intensity and the times when you're most likely to burn. You should apply sunscreen as frequently as indicated on the sunscreen packaging. However, on top of that, you should apply it if you've been sweating or if you've been swimming. Certainly in the peak heat of the day, the peak UV exposure, I think it's worth applying as well then, and if you're a child or if you're very fair-skinned. You need to apply more than you think when it comes to the quantity of sunscreen to achieve the SPF that you think you're applying. So it's actually 2 milligrams per centimetre squared. This is about a teaspoon for your face, a dessert spoon for your arm, a tablespoon for your trunk. So the total body coverage for a 70-kilogram man would be about 35 mils. In actual fact, studies have shown that we only apply between 1/4 and 1/2 of this amount. So we're not ever really getting the SPF we think we're applying. Everyone should use a sun protection factor on their face, even if you've got acne, and one just needs to choose an appropriate base to the sunscreen, such as a thinner lotion rather than a thicker cream, which might clog the pores. The mandelic acid is the perfect summer peel, as it gives a lovely glow without any downtime. It can also be used in conjunction with radio frequency, which helps to boost the collagen. If you burn your skin while on holiday, you need to cool it as fast as you can with cool showers if that isn't too painful. Then lotions are cooling preparations because the water evaporates and gives a cooling sensation. So calamine lotion is helpful. And then of course protect your skin subsequently and wear clothes when you're next out in the sun for the remaining days of your holiday. You can have IPL up to a month before you go on holiday, but you must wear sunscreen correctly, otherwise this will just contribute to formation of new pigment. When you come back from your holiday, you need to have let your tan fade before you can start your IPL course again.
we talk about moles, one easy mnemonic to remember when we're looking at moles and when patients are examining their own moles is a mnemonic called the ABCDEs. So the A being asymmetry, so is one half of the mole different from the other half of the mole? B is border, so is the border of the mole irregular? Is it poorly defined? Is it a scalloped edge? The C would be color, so a mole should be relatively uniform in color. If the color seems to be changing, if there's different shades of brown or reddish, that might be something that the patient should see their dermatologist for. D is diameter, so most healthy moles, some can be large, but most are on the smaller side. And if a mole is bigger than 6 millimeters or about the size of a pencil eraser, then that is a mole that may potentially be something that could be concerning. And then probably the most important one is E, which is evolving, so is a mole changing? So moles can change normally over a lifetime, and that's completely healthy, but a mole should not be changing or evolving quickly. So by quickly, I mean weeks to months. So if a patient notices that a mole has changed over that period of time, then I would probably recommend they see their GP or dermatologist. Unfortunately, skin cancer can affect everyone. However, there is a subset of people in the population, those who are very fair-skinned, who have a lot of freckling, or especially patients with red hair who are potentially at greater risk of developing skin cancer. Also, patients who have quite a lot of moles. So we say patients that even with 50 to 100 moles are definitely in a higher risk group, and they're patients who should definitely be screened at least annually or possibly more frequently. So most moles are completely healthy. I would say probably 5 to 10% of moles that look clinically atypical may require a biopsy or removal. So even if a patient is regularly followed by a dermatologist, I definitely recommend that they do monthly screenings at home. This can often be done before a patient takes a shower, just with a quick look in the scalp, on the face, and the body skin. You can even use a handheld mirror to examine your back, or have a loved one or friend help you, or be seen by a dermatologist. I recommend that patients of all skin types have their moles mapped if they have a significant number of moles, or if they have moles that potentially could be concerning. I think it's completely appropriate for patients of all different skin types, very fair skin to dark skin, have regular screenings and mapping. Generally, we recommend that patients have their moles mapped once a year. If they have a history of skin cancer or a history of atypical moles, we may recommend that they come in twice a year, or potentially even more than that. Generally, if we find a suspicious looking mole, I recommend that the patient have the mole biopsied within several weeks. Suspicious moles or lesions are removed by a small skin biopsy. This is done under local anesthesia with a small amount of lidocaine, and can be done either as a shave biopsy or a small biopsy that requires sutures. The most common traits that I look for when it comes to patients' moles goes back to the ABCDEs. We're really looking mainly for moles that seem to be changing very quickly, because this can sometimes be a sign of a type of skin cancer called melanoma, which can arise from moles. Also looking for moles that are the A, asymmetric, B, have irregular borders, C, have color that is unusual or that is different throughout the mole, and D is diameter. So again, moles that are very large can potentially be concerning.